Okay, so let me tell you about our weight loss that I offer. So just a little historical thing is that I actually have been a family physician for about 25 plus years now, and I got very interested in weight loss medicine, and I have gone through training, and I now have my boards in obesity medicine. And so weight loss in my office is called medical weight loss. So when you come for evaluation, the weight loss is very personal. It's also scientific. It's also, some physiology, pathology, genetic influences. So going through my training for obesity medicine boards, I really have been very lucky to have read extensively. So I also, I'm also the director for weight and wellness at Casa Colina Hospital for Rehabilitation, where I do once a month obesity management or weight management clinic. So weight management, medical weight management has come really, really far. Many circumstances where you have to absolutely lose weight, and studies actually as recent as last week from the AAFP journal, which is American Academy of Family Physician Journals, has endorsed this, that it does not matter how you do weight loss. It does not matter how many times you do weight loss. Every single time you have the benefit of the weight loss. So why do we need weight loss? Because of course we all know the obesity is one of the main fast growing disorder or disease that we have. And 1 in 3 American is either overweight or obese, okay? And they are about in an excess of 100 at least diseases or disorders that go with obesity or excessive weight. Now there are 2 types of things that happens with weight. So one, you are obese or overweight, or you have more weight, and you are metabolically stable, which means that your blood sugars and all these physical medical conditions are stable. Then you have just the obesity and have no problems. But the other group of people will have metabolic disorders, like you will have high blood pressure, cholesterol, sugar will be excessive, and also the mass effect, that is just by being heavy, just the mass effect. So all these problems come with obesity. So in the medical weight loss, so we have a vast array of things what I do, a very long list, but I'm going to summarize for you. So let's take a case of someone. I want to share a little story also, because I think it makes more sense. I had this lady who we recently have actually treated. She's an ex-fire and first responder. Because she was laid off, she went on disability because of some injury, and she gained weight. She was in chronic pain from her neck and her ankle, which she injured on her work, and has been told by her doctors that if she does not lose 30 pounds, she's not going to ever come back to work. And she really likes her work. She's looking forward to return to work, but they told her if she dropped 30 pounds, she could do this. So she came to us about 6 weeks ago. And my favorite way of actually treating obesity or overweight is to put them on what is called as full meal replacement. Now in full meal replacement, what we do is that we actually provide you shakes and bars, and we actually manage your food intake, because we do know that ultimately in order to lose weight, we have to give you healthy calories that are less than what you are being able to expand, right? By what you are working out. So calories in has to be less than calories out in order to actively lose weight, and it has to be healthy calories. It has to be a full nutrition. So there is a difference between starvation and calorie restriction. So we actually create calorie restriction and weight loss. So one of our most popular treatment is full meal replacement, and I'm very happy to tell you this patient is very healthy, has lost 30 pounds. She was going to be here today, couldn't make it, but she is absolutely out of her pain, and she's walking and she feels amazing, she looks amazing, and she has been in our program for 6 or actually 8 weeks now. So what we do here, we do a full comprehensive evaluation, we do an examination, we do an EKG for you. We actually have medications that we can dispense from here, because we are able to keep our medications for weight loss, and then of course the full meal replacement. after the full meal replacement, we usually gradually bring you down to partial meal replacement, and then we start introducing your food back again, but with some calorie restrictions. We actually keep an eye on you every week. So we keep an eye on you every week so that we can evaluate you. We do your blood work. We want you to have a physical exam. And so we do pretty comprehensive medical care. Another story of another patient. She's a nurse in the hospital. She was walking with a cane and needed a knee surgery. She went on disability for 6 months. She went to another doctor. She gained 5 pounds, whereas her orthopedic doctor told her to actually lose 30 pounds. She came to our office. We actually put her again on full meal replacement, and I'm so happy to tell you that today she has actually lost 30 pounds and she's ready to go for her knee surgery. So it's amazing that we see these cases, and they are really happy. And this is not so difficult because we actually do coaching in addition to our full meal replacement. We do the counseling here in office, or if need be, we send them out for counseling. And we also we suggest what exercises they have to do, because remember, whether it is active weight loss or weight maintenance or losing weight after gaining weight, whichever situation you are in, we have to make sure that you exercise. So it is a comprehensive program. If we want to know what you are eating, so we can support you. So it's a diet, exercise, and medications as necessary. So we are able to do a lot of products, a lot of things with our weight loss patients, and we actually keep the food here, we keep medications here, and so it's really working well. And one of the things I'm finding is the seniors, which we call seniors, they are not quite seniors because they are only 65 years and above, and they are in very good health, but they all need knee replacements. And the one important thing about weight is whenever the weight goes up, the knee arthritis or the osteoarthritis of the knees, it does get worse. We know that. So I have been very fortunate to see these patients at Casa Colina, which is a rehabilitation center. Many of these people need knee replacements. They all come to me before the knee replacement, and I'm successfully bringing their weight down by 20 pounds plus, and they all have gone through the knee surgery, and they are very happy, and it changes their lifestyle. Remember, it takes 4 weeks for us to actually learn a new skill. It goes for eating also, for lifestyle changes. And it takes 6 weeks and above to actually make it into a habit. So we are talking about, our programs run 6 weeks at a time, because we know that 6 weeks is a proven time. So we run our program 6 weeks at a time, whether it's full meal replacement, partial meal replacement. And studies have shown that you can actually do full meal replacement up to 2 years. And because our nutritional food are complete food, there is no deficiencies. We usually check your blood work. So we have been very successful with that. And that I would say is my most popular treatment. We love our medical weight loss program, and I think we have benefited many patients with it. And if you want your consultation, again, call us at 909-377-2939.